The summer initiation season is underway in the Eastern Cape. The Provincial Health Department says it's ready to provide medical support to traditional leaders. At least 20 people lost their lives during last year's initiation in the province. They died from dehydration, underlying health comorbidities and diabetes. Now, Provincial Health spokesperson Sizwe Kupelo joins us from East London virtually to discuss this further. Sizwe, thank you so much for your time. It's quite telling that, unfortunately, we need to have this conversation every year, because one life lost during this important traditional season is one too many. I think you'll agree.
Well, we remain concerned about the fact that we continue to lose lives during initiation seasons. This is why we have stepped in as the department to assist the custodians of the custom with the necessary support, which ours is limited to medical support. We are also providing resources such as the human resources, the officials that would work with traditional leaders or the custodians to monitor and also conduct rescue operations where necessary. We've also allocated additional 45 4x4s in order to access the inaccessible areas of our province.
How long before, because I know these dates are set aside quite long in advance for when the initiation processes will take place. How long in advance are you starting this conversation and indeed this engagement with traditional leaders to inform them of the services that you are making available?
We continue to engage before and post circumcision seasons in order to conduct postmortems on the previous operations, look at areas of improvement, areas of further assistance. So the conversation always continues, and we continue to provide medical care in our health facilities. We've got one hospital in the province, which is Nelson Mandela Academic Hospital, which was also through specialist assistance, those who were unfortunate and ended up losing their manhood while in the bush. So we've got plastic surgeons that have been conducted, and we've got few boys that have benefited from that.
How important is engagement with the families and the communities that these young men are coming from? Because one would think that they perhaps can be used to put pressure on these traditional leaders to make sure that they've got the medical resources behind them once these young men are in their care. What are you hearing from these families and these communities? Are they able to put pressure on these traditional leaders to take your help?
Well, the issue is beyond traditional leaders. It's beyond those who are directly involved. The most important stakeholder in this issue are the parents, because this is a communal issue. And the problem starts there at a communal level. It starts there at households on how they plan and how they coordinate this whole issue. And the most challenging issue in the Eastern Cape are those people who continue to disregard the stipulated laws that are aimed at assisting the process. Those who go on their own, engage on issues that are outside the formal structures that have been set up to ensure that loss of life is prevented. So if we can deal with those circumstances, we can win the battle. So traditional leaders are just one element that is there to ensure that customs are respected and are done accordingly. But parents in this, and boys themselves, they need to realize that this issue is very serious. And if they don't comply with the laws, they are effectively putting their lives at risk. And most importantly, they run a risk of actually losing their manhood. And we've seen from early 2000, in the Eastern Cape, we've got more than 500 boys that today are living without manhood.
Sizwe, tell me, what are some of the things that you're hearing from these people who are against taking any help from authorities or ensuring that they've got medical backup? What are you hearing from these young men who are against it, or indeed from their families and communities who are refusing that kind of help?
Well, the issue is concentrated in certain parts of the province, not the entire province. where there's proper coordination and adherence to the law, you don't experience these challenges. But in some areas where there's total disregard of the processes, where there's total ignorance, where there's total disregard of parents or elders in those areas, you begin to experience these challenges because boys themselves, very young, for them to understand even the issue of manhood, the issue of initiation. That's why you get these issues. So this is why we also, in our support, also engage on community awareness, engaging in embarking on awareness campaigns, sometimes targeting schools where these boys would be found in order to raise awareness and also try and pursue them, make them understand that life is more important and health is also extremely important, because it's not only deaths that are related to botched circumcision, but even those who would have gone to the bush, having kept the health screening process, are exposed to serious risk, because these days you will find boys living with chronic conditions which, in the event where these conditions are not managed very well medically, they can actually put the life of that particular patient at risk.
Okay, we're going to leave it there. Thank you so much for that update. Eastern Cape Health spokesperson Sizwe Kupelo joining us virtually from East London.